symptoms. The predominant symptom is pain in the upper abdomen associated with bloating, maybe feeling of reflux, and feeling like the food isn't digesting and kind of sitting in your upper abdomen. So it's kind of an umbrella term that we use quite broadly to describe a whole number of symptoms in one. And patients often call it indigestion. Doctors may call it dyspepsia, which is kind of similar terms. They use interchangeably. But overall, a patient that presents with dyspepsia or indigestion requires further testing to figure out what's going on. Sometimes it's simple, maybe overindulgence, certain types of foods, or eating a very heavy meal may give you indigestion or dyspepsia. And sometimes it may be more sinister. There may be ulcers, there may be reflux, or there may be problems in the pancreas, gallbladder, for instance. So, the start of the symptom of dyspepsia requires further investigation to figure out exactly what is going on. So I think, patients often get confused about, if I present with this symptom, what does it mean? But it usually means we've got to try and figure out, doing further testing if necessary, or by further questioning what the problem could be.
Okay, so have we covered all aspects of these symptoms that people could actually go through?
Look, I think the commonest symptoms people present with is bloating. So bloating means, soon after eating, you feel like there's air in your tummy and the food isn't moving, it isn't digesting. And together with that, often patients complain of reflux, which is a feeling of discomfort or heartburn, where discomfort starts up in the upper abdomen and spreads up to the chest. And the other symptoms tend to be like nausea, if you together with all of this. So it's kind of a mixed bag. So often when a patient presents to me with this kind of symptom, it's a matter of sitting with them and going through the symptoms and trying to figure out exactly what is going on and trying to figure out what could be triggering the symptoms, and could it be exacerbated by certain things in their diet? Are there any medication which can make it worse? Because lots of medication can actually affect your tummy as well and give you the same symptoms. So often anti-inflammatories, headache pills, steroids and stuff, which you use for other diseases, tend to give you symptoms in the stomach. And we need to try and figure out, is it related to medication? Is it related to the kind of diet they're following? Or is there something else going on which needs further explanation? And often, a careful history and examination of a patient, we should be able to figure out what we need to do. If it's something that's long-standing and it's causing further symptoms like weight loss, or if you're concerned about blood loss or anemia, then clearly that patient needs to be investigated doing endoscopies. If it's something very short, of short duration, and the symptoms aren't that severe, then perhaps maybe just a change in their diet or omission of certain medications may relieve the problem. But in any patient where the symptoms are persistent and requires ongoing treatment or the use of antacids and so on, and there's no real explanation of what's going on, for sure that person will need further investigation. And the commonest for the next investigation would be an endoscopy. So the best option may be to see your doctor with this problem, have him take a detailed history to try and figure out where the problem could be originating from, and then from there decide whether further investigation is required.